Hello everyone, I am Elizabeth from BSED Science TC. So my topic for today's discussion is about contraception. And my learning objectives are to identify what are the kinds of contraceptives and to know how does it help to prevent unwanted pregnancy and to know the disadvantages and advantages of applying contraception method. So what is contraception? Contraception is also known as birth control. It is designed to prevent pregnancies. Birth control or contraception can work in a number of many different ways. One is to prevent sperm from getting to the eggs, and the contraceptives types are condoms, diaphragms, cervical cups, and contraceptive sponge. Number two, keeping the ovaries from releasing eggs that could be fertilized. Those types includes control pills, patches, shots, vaginal rings, and emergency contraceptive pills. Third is IUDs, devices which are implanted into the uterus that are IUDs. They can keep in place for several years. I will discuss that later. Lastly, the sterilization, which permanently prevents someone from getting pregnant from being able to get someone else pregnant. So, next, I have questions here. The question is, are you happy that you are born in this world? Or do you feel lucky that you are born? You can answer these questions and comment on the comment section. Don't hesitate to comment. So this is the first type of the contraceptives. First is condom. It is a sheet-shaped barrier device used during sexual intercourse to reduce the probability of pregnancy or sexually transmitted infection. Next is the oral pill. This is often referred to as the birth control pill or colloquially as the pill. It is a type of birth control that is designed to be taken orally by women. It includes a combination of an estrogen and a progestogen. Next is intra, intra, intrauterine device or IUD. That was mentioned earlier. This is a small T-shaped device. It is made of material containing progesterone hormone, or plastic and copper, and it is fitted inside a woman's uterus by a trained healthcare provider. It's a long-acting and reversible method of contraception, which can stay in place for 3 to 10 years. This is the long term, depending on the type. Some IUDs contain hormones that are gradually released to prevent pregnancies. The IUD can also be an effective emergency contraception if fitted by a healthcare professional within 5 days, which is 120 hours of having unexpected sex. Next is the contraceptive implant. In this method, It's a small, flexible rod is placed under the skin in a woman's upper arm, releasing a form of the hormone progesterone. Progesterone. The hormone stops the ovary releasing the egg and thickens the cervical mucus, making it difficult for sperm to enter the womb. The implant requires a small procedure using local anesthetic to fit and remove the rod and needs to be replaced after 3 years. Next is the contraceptive injection. The injection contains a synthetic version of the hormone progesterone. It is given into a woman's buttock or the upper arm, and over the next 12 weeks, the hormone is slowly released into your bloodstream. It has a pros. The injection lasts for up to 3 months and is very effective, permits sexual spontaneity, and doesn't interrupt sex. Next, emergency contraception pill. The emergency contraception pill can be used to prevent pregnancies after. If contraception wasn't used, a condom has been broken during sex, or a woman has been sexually assaulted. While it is sometimes called the morning after pill, it can actually be effective for up to 5 days after having unprotected sex. The sooner, the sooner it is taken, the more effective it is. When taken in the first 3 days after, it prevents about 85% of expected pregnancies. Next is the contraceptive ring. This method consists of a flexible plastic ring constantly releasing hormones that is placed in the vagina by the woman. It stays in the place for 3 weeks and then you remove it. Take a week off, then pop another one in. The ring releases the hormones estrogen and progesterone. These are the same hormones used in the combined oral contraceptive pill, but a lower dose. Next is the diaphragm. A diaphragm is a small, soft silicone dome is placed inside the vagina to stop sperm from entering the uterus. It forms a physical barrier between the man's sperm and the woman's egg. Like a diaphragm needs to stay in place for at least 6 hours after 6, but no longer than 24 hours after it needs to be taken out and cleaned. Lastly is the sterilization. Sterilization. Sterilization is the process of completely taking away the body's ability to reproduce through open or minimal invasive surgery. It is a permanent method of contraception suitable for people who are sure they never want children or do not want any more children, especially kung laki na. Sterilization is available for both women and men and is performed in a hospital with general anesthesia. If you are thinking about sterilization, issues to talk with your doctor about include your reasons for wanting to be sterilized, whether other methods of contraception might be more suitable, and any side effects, risks, and complications of the procedure. So next we're going to tackle about the 10 benefits or the advantages of using contraceptives. But first, Let's talk. Let's read this. Hormonal birth control is a lifesaver for many women trying to prevent unwanted pregnancies. Of course, then hormonal methods have their benefits too. But hormonal birth control, including the pill, some IUDs, implants, and patches, offer a range of benefits beyond pregnancy prevention. First, it is it is to regulate menstrual cycles. Hormonal birth control methods may balance the hormonal fluctuation that happen throughout your cycle. This can help with a variety of menstrual issues, including regular or heavy bleeding. It even prevent, I mean, it can even help with polycystic ovarian syndrome or PCOS, including ache and excess hair. Learning more about the best. While the various birth control methods work differently, most trusted sources can make periods lighter and more consistent in their timing. And number two, it makes periods less painful, especially to those having suffering for a what's it called this dysmenorrhea. About 30% of women who use birth control pills cite the menstrual pain as one of the reasons they continue to take them. Hormonal birth control prevents ovulation. When you do not when you don't ovulate, your uterus doesn't experience the painful contractions that cause cramps during ovulation. If you have painful periods, hormonal birth control may also provide some relief for pain during menstruation. Third, it can banish normal ache. Hormonal fluctuations are often major ache triggers. That's why ache is usually at its worst during adolescence. By minimizing the fluctuations, hormonal birth control can help to tame hormonal ache. Birth control pills that contain both estrogen and progesterone are the most effective ache fighters. So, number four is it reduces your risk of uterine cancer. Hormonal birth control also has some long-term benefits. Women who take combination birth control pills are 50% less likely to get uterine cancer. These effects can last for up to 20 years after you stop taking the pill. It can also reduce trusted source your risk of ovarian cancer. It Number five, it reduces your risk of ovarian cysts. Ovarian cysts are small fluid-filled sacs that form in your ovaries during ovulation. They aren't dangerous, but they're sometimes painful. Women with PCOS often have a large number of small cysts in their ovaries. By preventing ovulation, hormonal birth control can prevent these cysts from forming. They may also stop former cysts from regrowing. Number six, it can relieve symptoms of PMS and PMDD. Many women experience some mix of physical or emotional symptoms in the weeks of days leading up to their period. This is known as the premenstrual syndrome or PMS. Like most other menstrual issues, PMS is usually due to hormonal fluctuations. Hormonal birth control is also a potential treatment for premenstrual diasporic disorder or PMDD. This is a type of severe PMS that tends to involve more emotional or psychological symptoms. It's often hard to treat, but a combination pill containing drospirenone, and ethyl estradiol is approved by the Food and Drug Administration for treating PMDD. It is the only birth control pill to receive FDA approval for this purpose. Just keep in mind that experts are still trying to fully uncover all the underlying causes of PMS and PMDD. Adding to this, different birth control methods have different doses and combinations of hormones. You may need to try a few options before you find one that works for your symptoms. Number 7, it helps to manage endometriosis. Endometriosis is a painful condition that happens when a tissue lining in your uterus called the endometrium grows in place other than inside your uterus. This tissue bleeds during your period no matter where it is located. When the tissue bleeds in place where blood can't easily get out of your body, it causes pain and inflammation. Hormonal birth control methods help because they allow you to skip periods. Continuous birth control pills and IDs are usually good options for managing endometriosis. Number 8, second to the last, it can help with menstrual migraines. A migraine is an intense type of headache that affects almost 30 million trusted sources of American, or 75% of those being women. This is partly because hormonal changes are a minor trigger for migraines in some people. Experts think menstrual migraines are linked to a drop in estrogen and progesterone just because your period starts. Hormonal birth control methods that allow you to skip your period, such as a continuous pill, implant, or ID, can help avoid this trap. Lastly, it gives you the freedom to bleed on your own terms. Not the last. For the most menstruating women, bleeding is just a fact of life, but it doesn't have to be. Most packs of birth control pills come with a week of placebo pills that don't contain any hormones. They're just there to keep you in habit of taking a pill every day. Usually, you'd get your period while taking these pills. If you have a big vacation or other event coming up during the week, skip the placebo pills. Instead, start a new pack. This method works best if you take monophasic birth control pills, which all contain the same dose of hormones. Then, this is the last. It can reduce your risk of anemia. Some women experience very heavy bleeding during their periods. They can increase the risk of anemia. People with anemia don't have enough red blood cells to carry oxygen around their body, which can cause weakness and fatigue. Hormonal birth control methods that allow you to skip your period can help to prevent period related anemia. So, that are the benefits or advantages of using contraceptives. Next, the disadvantages. This is just a short information about disadvantages of using contraceptives, but you can also search more about it. The disadvantages, adverse effect include nausea, breast tenderness, breakthrough bleeding, amenorrhea, and headaches. Oral contraceptives do not provide protection from STDs. Daily administration is necessary, and inconsistent use may increase the failure rate. So, thank you, and thank you for listening.